So I just have two simple questions. All right, so first, I'll ask, all the employers out there, the C-suite, the executives, the leaders, just a simple question. If OSHA showed up to your business today and they were there to conduct a COVID-19 inspection in accordance with the updated enforcement response plan, of course, how would you do? Now, would you even know what they would be looking for? All right, the second question is, if you're an employee, you know, would you even know what they're looking for? And which actually maybe more importantly, would you even know what your rights are and your expectations for a safe workplace is? Now, I'll just make the assumption that for both those questions, the answer is what? And don't worry, because we're actually going to cover some of those things right now and cover both as a business owner, operator, executive leader, but also from the employee standpoint as well. We'll take care of that right now. Hey, Dustin here, and today we're going to talk about the updated interim enforcement response plan for COVID-19 and OSHA's National Emphasis Program, and really what it means to businesses, right? Now, JacksonLewis actually put out a great article about this topic. The link will be down in the descriptions, but they lay out some great key points with the new legislation. Now, the first thing that really kind of caught my eye is that in order to limit the in-person meetings with employers, OSHA is actually going to encourage, I'm just going to throw it out there and just say mandate, that employers actually provide data and documents electronically prior to an on-site visit, right? So if OSHA is going to come out, they're going to let you know and say, hey, we're coming out. I expect to see these things before I even show up. Now, it's a pretty robust list, so let's take a look at it. All right, so before we dive into the specifics here, just want to talk about just two quick things. Number one, are you even documenting all this required data that we're about to go over? And second, if you are, fantastic, but how easy is it for you to pull all that data and then just, send it over to OSHA? So think about that stuff. Here we go. But let's get into the bullet points here. So the first one here talks about, do you even have a written safety and health plan? Now, a lot of employers have that, but the caveat here is that it has to have a pandemic plan. Hey, new here, right? Second one is talks about, PPE. Again, this is a lot of times in your already, safety plan you have there. Have you taken steps to ensure, distancing? What about face coverings? Medical records related to any type of worker exposures? Do you track all of that, right? What about a respiratory protection plan, right? I mean, like all these things, a lot of times these things are new, and yes, we may implement procedures in place for your crews and everything, but you probably don't have it documented. Now, what about training records? Now, those training records, CPR is great, the forklift training is great, all that stuff is great, but now this training now is now required that you include training on COVID-19 exposure, not just the prevention of it, but pandemic preparation. And then all these things, of course, you make sure that you document everything, and including you as an employer, all the efforts that you've made to obtain and provide PPE for your crew. Now, if you actually happen to work in the healthcare world, great news, you have additional requirements here, and here they are. But again, a lot of the stuff here will pertain directly. So a lot of stuff won't make sense for the vast majority of people here. But again, we'll dive a little bit deeper into it because there are some additional requirements, which we'll cover a little bit later for healthcare market. But just understand that it's going to be even more robust for you. And that makes sense, right? So now once OSHA gets their list of documents ahead of time, of course, they're going to take a look at it and kind of put some called areas of concerns that they're going to be going through. So now, day of the actual inspection comes through, just expect them to spend a little bit more time actually in their places of high hazards, right? So think about your break areas, your locker rooms, meatpacking, assembly line, and manufacturing plant. Now, again, if you do happen to work in the healthcare industry, it's going to be a little bit more robust. Now, some of the things that they may do, and this is according to this article by JacksonLewis, is that, they may actually look at, again, they're going to provide some video and photos, but again, according to this article and according to what really makes sense, is they're going to try to protect patients as much as possible as far as their identity and everything else. But, they're going to potentially have recordings as far as smoke tube testing of the airflows inside and outside, an airborne infection isolation room. Don't know what that is. Don't ever really want to know, just to be honest. But they'll most likely, according to this article right here, and here's the quote, test a room's ventilation or airflow, such as rooms where aerosol generating procedures are performed. Now, again, not being a very smart person, especially in the medical side of things, I don't really know what that means, but it just sounds really cool that they're going to shoot smoke all the way through your hospital. I'm sure that's not the case, but that's what it looks like to me anyways. So now comes the question of, okay, so now the inspection comes, everybody wants to know what's issuing citations looks like. Now, when it actually comes to issuing citations, thankfully, the OSHA has put out their most likely CFRs that they're going to follow. Now, of course, we all have these memorized, but just in case you don't, there they are. And it does sound like, just from this article anyways, that OSHA will take I would like to think anyways, a reasonable scope of things. And that is truly, I mean, if there is a hazard and the employer has not done a job to actually safeguard their employees, using these 4 steps here, I would like to think that OSHA will understand, like, hey, we tried the best we could. Things still happened, as we would like to hope with everything, right? But just in case, here's the 4 things that they're going to be looking at. Okay, so we've covered, what they're going to be inspecting. We've covered the CFRs that they're going to be looking at. We've kind of also covered like the 4-point litmus test for businesses, right? Now, one last thing before we get away here, and that is, we talked about the federal level, and that's OSHA. We haven't really started talking about the states. So that's another big component of all these new requirements and that is, there's been, as of April 1st, there's actually about 17 states and Puerto Rico, which have passed legislation placing the burden of proof onto the employer. And so that means if there is a positive case of COVID and an employee comes from your work, the burden of proof really is on those employers to actually prove that, they didn't get COVID there. Now, again, there's a lot of trouble, number one, with just proving that fact, but it's almost impossible to say, no, my employee did not get COVID here at my job. In New Jersey, where I live, this was actually passed last year. I think it was November 1st when it went into effect. But I mean, it comes up with another litany of just workplace requirements. So New Jersey and the other states here may have very similar functions and actually legislation like this right here. Now, again, this is New Jersey. This is Executive Order number 192. If you have trouble falling asleep, you want to read something, there it is. But yeah, New Jersey actually mandates, social distancing. You see here, 6 feet of distance. Now, it does say maximum extent is possible. Of course, there are some jobs you just can't do that. Requires to wear face masks. Okay, we get that one here. But actually enforces that the employers actually provide the face mask. Now, again, you're into it, pretty much everybody has their own, but again, putting the burden on to the employer, you actually have to provide sanitation materials. You actually have to ensure that your employees practice hand hygiene. So yeah, I'll just leave that one there. But again, there's a lot of other things here, but one of the big things here that I know we talk about that I just feel like maybe not be enforced, and that is, you actually have to conduct daily health checks. Now, a lot of times it's just, hey, how are you feeling, whatever. But the important thing here is that you have to have temperature screenings. You actually have to have self-assessment checklists. You have to have questionnaires. You have to have consistent with CDC guidance, which may or may not change, which you have to keep up with. But you actually have to be able to give that data back to OSHA, to, in this case, New Jersey, if they come knocking on your door and asking for it. So again, these are a lot of different things that we may not be fully, up to speed on. Again, you may have the OSHA, you may have the state, but you may not have both, or you may not even be aware that this is actually a real thing now. But for sake of time, let's just go back to the beginning, right? I asked you 2 quick questions, very simple ones. And the first one was, as an employer, if OSHA showed up today and said, hey, I'm conducting a COVID-19 test in accordance with the new, legislation, how would you do? Would you even know what they'd be looking for? And the second question is, if you're an employee and OSHA came to your door, would you even know what your requirements are and what your expectations for a safe and great workplace is? And so, I'll just leave those questions out there for you. Be safe, be awesome, take care.